flying in the age of coronavirus. One of the consequences of the coronavirus pandemic has been the enormous reduction in global air travel. Some airlines grounded their entire fleets, while others focused on cargo flights, in an effort to help keep supply chains functioning and make a profit. Some might say that the airplanes have never been cleaner today. Maybe they're right. Airlines, airports, and aircraft manufacturers are going to extraordinary lengths to get passengers flying again, and that means upping the confidence factor in taking to the sky while the coronavirus continue to rage on the ground. I'm Captain Saeed, and you are watching me on Aviation at Home channel. I hope by the end of this video you find out your answer either to plan your air travel or not confidently. Today I have 5 tips for who's want to fly or are frequent flyer to have safer flight as much as 90% against COVID-19. Nowadays, people ask me a lot about air travel during age of coronavirus. They have some questions like, is it safe to fly during pandemic period? Are airplanes safe to sit in for 5 or 6 hours at a clip? Are masks still necessary to wear on board the airplane? Or they ask, what if the person behind you has a fever a smidge lower than the allowable degree? What if the person in the middle seat start coughing? Or sometimes they say, should you touch the seat back bottom or use the tray table? Now I will give you 5 tips about airplane design and airlines and 5 tips about self-protection in one sentence. Let me say that the airplanes are as safe as your office, but not as safe as your home. So, if you're ready, let's go through our 5 tips. Tip number 1. Airlines are claiming that flying has never been cleaner or safer. In many ways, they are right. Airlines are looking at disinfecting practices and devices that could be instrumental in killing the bacteria and viruses from the surfaces passengers touch, giving each passenger has a completely sanitized environment on takeoff, which was not like this before. Key number 2, I can say since mid-1990s, after HEPA filters were introduced and installed in airplanes, the air circulation inside an aircraft is filtered by its before delivered to cabin by HEPA filter. These filters are medical grade, often used in hospital isolation chamber and operating rooms to scrub the tiniest particles, including viruses, from the air with 99.9% plus effectiveness. The HEPA filters have not been tested for COVID-19 yet, but have been tested with the particles the size of the virus and deemed extremely effective. Key number 3, a new measure that is being recommended to airlines at this time is to maximize the cabin airflow and HEPA filtration, not only during flight, but also on the ground to filter cabin air during passenger boarding and deboarding. Number 4, another key point that many passengers do not know is the direction of the airflow is not from front to back in cabin, and the airflow is usually from top, I mean the ceiling, and comes down onto the seat and exit outboard. So the air is not widespread. Number 5, another important key is that the cabin air is exchanged every 2 to 3 minutes, which is much faster than the office building and other interior space where people go. Up to here, we discussed mostly about airplane design and systems, which is out of our hand. On the other hand, we need to do some tasks to protect ourselves from this virus. Number 1, buy your flight ticket from airlines that have already published disinfecting practices. You can easily find it out from their website or social page. Key number 2, as I told earlier, the airplane newer than almost 25 years old have HEPA filter. So before you buy your flight ticket, check the airplane type and age. So in this period, you should be more careful about choosing your airlines and airplane type. Number 3, currently there is no regulation to distance passenger on board a commercial aircraft. This means airlines are not willing to block the mid-seat. But if your financial budget permits, you may block 2 seats for yourself and have enough social distance during flight. Key number 4, in flight, do not use more public areas of the airplane like lavatories as much as possible, and always carry your sanitizer in your pocket and in reach to clean your hands every 30 minutes interval. Key number 5, HEPA filter can only clean the air that circulated through them. So if a passenger sneezes, the filter cannot clean the air. That is why the current health emergency, it's important to work across the industry of the additional protection, such as face masks. Now, airlines are asking all passengers to wear the mask while on board. I hope this video was useful for you, and be informed we have more than 200 videos in our YouTube channel. So right now, sit back, relax, and enjoy your training.